Greetings, listeners. Welcome back to Columbia Lighthouse for the Blind's Where Are We Now? Here we are, fall of year 2022, and we continue to have a successful and productive year at Columbia Lighthouse for the Blind. I'm joined by our president and CEO, Tony Cancelosi, as well as our featured guest, Dr. Friedman. Tony, welcome. How are you? How are things at Columbia Lighthouse for the Blind? We just concluded National Disability Employment Awareness Month.
Jocelyn, it has been an exciting year so far, and it's even going to get better, and we only have 2 months left. One of the most exciting things that happened to us this year, besides many other things, was that we were selected among 115 NIB agencies as the Employer of the Year award. And it all revolved around winning some government contracts that are exceptional, and exceptional meaning that we hired, in one particular case, more than 35 individuals that were visually impaired and blind. So when you think about that whole area of employing people with disabilities, we have achieved that and won that national award. And more importantly is the government contracts that we've won this year are 5-year contracts, and they're worth millions of dollars. But more importantly is employing more than 75 individuals that we have within that organization. So exciting is the right word, moving forward is the right word, and achievement is the right word. All of that accumulates into one major thing. Independence is our vision, and independence is for more jobs. Independence is for more accessibility. And more important is to have our people have accessibility to vision testing from Dr. Friedman and others, that we will be always there to help them.
That's great. Yes, we are extremely proud of the work that we and our fellow team members perform here at Columbia Lighthouse for the Blind. And it has been an exceptional growth year. And one of those areas that has helped CLB continue to grow and to serve our community is low vision services. And we're so pleased today to welcome Dr. Henry Friedman to Where Are We Now? Dr. Friedman, welcome.
Thank you very much for having me, Jocelyn.
I've had the opportunity to work with Dr. Friedman for a number of years now. He is our low vision doctor, and he's based in our Silver Spring, Maryland office, home to our low vision clinic. Dr. Friedman, right off the bat, I would like to know from you, the expert, what is low vision exactly?
Low vision in lay terms is eyesight that is blurred, distorted, or indistinct, and cannot be corrected with glasses or contact lenses. A lot of people will say, if I take off my glasses, I'm legally blind or I have low vision. This is about best corrected visual acuity. Formally, low vision is defined as visual acuity of 20/70 or less. For reference, normal sight is 20/20 visual acuity, and visual fields of about 160 degrees, which if a person were to stretch their arms out to their sides, on both sides, if you stare straight ahead, you could see your fingertips. 20/20 acuity and pretty much a full field in front of you is considered normal vision. On the other hand, legal blindness, which qualifies one for disability benefits, is 2200 or worse, or with a maximum of 20 degrees of visual field, which would be the equivalent of looking through a paper towel tube.
This is very helpful. A question that we commonly get at Columbia Lighthouse for the Blind is we're out in the community interacting with patients and consumers, caregivers. If someone is legally blind, does that mean that they have low vision or vice versa? Are there certain conditions that could lead to low vision? Certain diseases of the eye that lead to low vision?
Yes. So on the first question, a person who has low vision is not necessarily legally blind, but a person who's legally blind definitely has low vision. So low vision is less impaired than legally blind. About the second part, common eye conditions that cause low vision, I'll talk about what I see most at CLB, and I think is pretty representative of the community. We have macular degenerations. A big one is diabetic eye disease. People who have diabetes often have complications that relate to bleeding or leaking blood vessels or edema on their retina. And so they often have reduced clarity of sight. The third big one is glaucoma. And then two others are retinal degenerations, such as retinitis pigmentosa or albinism, where a person doesn't have proper pigment either just in their eyes or in their body as a whole.
So a wide range of eye conditions or diseases could impact someone's ability to see and likelihood of having low vision, I gather.
That's exactly right.
And with your examinations, what is the process? And do these exams differ from a standard eye exam if I were to go to a optometrist next door? It's the same as the experience I would get from you, a low vision doctor.
I think you would get a very different experience, Jocelyn. A general eye exam, no matter who it's performed by, is going to concentrate on ocular health, number one, and number two, on providing eyeglasses that allow a person to see more clearly. As opposed to that, the examination process that I use is much more oriented towards determining how the vision impairment is affecting the person's life and how to maintain or improve their function in spite of that decreased vision that they suffer from. So the low vision exam is not about treating the eye condition that caused the reduced sight. That's the aegis of the ophthalmologist typically, but it's more to allow the person to function optimally in spite of the fact that they have eyesight loss. Now, my examination, there's a lot of discussion. So I have a lot of questions for the patient. Some of them are quite personal. I'll explain why in a minute. All of them are aimed at helping me gain an understanding of where and how the person lives and what tasks are most important to them. So I'm going to ask them about whether they live in a house or an apartment. I want to know whether they have to negotiate stairs. I want to know whether they live with other people or whether they have pets. In both cases, there might be objects underfoot that they might trip over or furniture that gets moved around that they might have to negotiate. I want to know whether the person is seeing well enough to care for their daily life needs, such as being able to bathe themselves, get dressed, cook their meals, and go shopping. I want to know whether they can travel outside their home. Can they see the crossing signs? Do they feel comfortable that they know whether cars are coming? I want to know whether they're still working on jobs that they may need specialized help with. I want to know what their leisure time or hobby demands are. I want to know how they're able to interact with others, whether they can recognize people's faces or expressions. And of course, I want to know how their reading is because that comes up all the time. So I spend time with patients testing their visual acuity. I make an estimate of their visual fields. I look at their eye movements. I look at their eye teaming. I may or may not need to do a refraction to determine whether they're already wearing their best possible glass. Many times a person comes in and they've seen many doctors before me and we have the feeling that they've already got the best. I might not feel the need to examine for new glasses again, or if the person has lost the glasses or aren't sure, maybe I do that refraction again. And then critically, I need to determine the amount of magnification necessary to help them see better. I test the effects of lighting and also tints, different colored tints to see whether I can improve their contrast, their clarity. So in summary, if you go to most eye doctors, they may spend a half an hour with you just looking at your eyes primarily. I spend much more time than that trying to get to know the person, to get to know their visual needs and their goals.
Yes, it sounds like it is quite a thorough, extensive process, all for the well-being of the patient so that they can have, as Tony mentioned, that independent quality of life. Now, Dr. Friedman, do you provide that type of assessment and interaction for patients of all levels? At Columbia Lighthouse for the Blind, we serve youth and young adults, children. Have you been seeing patients who are youth and young adult and giving them that type of assessment, evaluation, best practices for them to help reach their goals?
Absolutely. Maintaining or restoring visual function is independent of age. It's for everybody.
Very important, very significant. Yes, Columbia Lighthouse for the Blind, we meet people wherever they are in their life stage. You are exactly right. I agree. With the evaluation process, does it allow you the opportunity to intersect with our other program leads, vision rehab therapy, maybe introducing someone to our Foundations of Adjustment to Blindness program, or orientation and mobility? Have you, through your service at Columbia Lighthouse for the Blind, had opportunity to make those connections for patients?
Many times, Jocelyn. In fact, one of the things that appeals to me very strongly about working for Columbia Lighthouse for the Blind is that I don't feel that I'm on an island somewhere by myself trying to deal with every aspect of a patient's needs, because I'm just not equipped for it. So I have made many referrals for independent living skills assessment, orientation and mobility, and adaptive technology assessments and training. I do it all the time. In fact, I would say it would be rare for me to spend a day at the clinic at Columbia Lighthouse and not make a referral to someone else in the Columbia Lighthouse system.
That's great. Yes, we are fortunate at Columbia Lighthouse for the Blind to provide that comprehensive program structure that allows for us to work collectively, again, for the well-being of the patient, the consumer we serve. And Dr. Friedman, if patients are listening right now, caregivers, our medical community, and they would like to learn more about low vision services and what you might be able to offer with the interventions, with the evaluations, can they just contact us? Can they go to our website? Can they call our main number? What is the best means to get that exam scheduled?
I think starting with the phone call to the main number and get an appointment scheduled is the way to go. On the other hand, if someone is not sure whether our services are correct for them, Kathy or Rahel or Chriselle, who may take the initial call, are always welcome to get in contact with me and present me some information about the patient. And then I can get back to them about whether I think that it's a proper move for the patient based on what I've heard. I don't mind doing that at all. They also are pretty well versed on their own, knowing what I provide. And so they have a pretty good idea of what I can do for patients and what I can't. I'm always trying to educate them about what I'm doing. I talk to them about the patients that I see so they have a better sense of what goes on in the clinic when the door is closed.
That's great. Education on all levels for patient care, for the direct staff, the team that works very closely there with you in Silver Spring, That's terrific. Making yourself available and sharing your knowledge is essential and appreciated. And again, listeners, you can give us a call at Columbia Lighthouse for the Blind for intake, for scheduling. The main number 202-454-6400. And you are welcome to visit our website, contact us on social media, send us an email or a web inquiry at clb.org. Dr. Friedman, it has been wonderful learning more about low vision, learning about your expertise, and really getting a clear understanding and picture of what low vision is, what the evaluation process is, and what those interventions are. We are grateful to you for your many years of service to our community and Columbia Lighthouse for the Blind.
Thank you very much, Jocelyn. It's been my pleasure to work alongside all of you for these last years.
Thank you. Tony and I are very appreciative to everyone who has continued to support Columbia Lighthouse for the Blind this year, 2022. As we come to the close of our year, we are eager to continue to serve our community, and we cannot do it without your continued support. And we hope that you all will consider supporting us again this holiday season. Our website is clb.org, where you can make your online contribution or contact us directly if you would like another means of giving your year-end donation to Columbia Lighthouse for the Blind. On behalf of Columbia Lighthouse for the Blind, we thank you very much for tuning in to this edition of Where Are We Now? Please continue to follow us on clb.org. We wish you a very healthy and happy holiday season and a happy and healthy new year. Thank you.